talk about that alignment where you the ear over the shoulder, shoulder over the hip, hip over the knee, knee, ankle. So she's in pretty good alignment there. Okay. So I'm just going to start here. I'm basically just going to go like this far, maybe. I don't know. We'll see. I like to start like this. What's going on here, Lou? Anything
my
should
arch
avoid?
has been pulling. No, it's fine.
I don't say that now. I'm just going to make sure. So I'm just going to start with a little hip opener. See that movement in the hip and it starts to open up that space below the 12th rib and the iliac crest. So simple, right? And you got to release slowly. So when you go into this alignment, stabilize, and you lift the leg and you bring it over here, so you're pulling in a straight line. If you're not, they'll get some stretch, but not as much because they're going to either roll forward or back. So you lift, and then just lean back. It's okay, Rose?
Yes.
And release easy, right? Cool. Now you have their attention, I think, and they probably think that you know what you're doing. So they might relax a little bit more. So, yeah, pillow, but let's try this. So lift your head. So I've been doing this more, because I like the contact, all right?
Nice.
Is it okay, Rose?
Mm-hmm.
And, we can do a few things. And I like to start with a little compression right into the side of the head. Because if you're looking at it anatomically, the temporalis, this fan muscle on the side of the head, it has not only an effect on this side of the sutures of the head, but also it affects TMJ, right? Because the tendon, that's one of the muscles in TMJ, the temporal muscle comes down just below your dog's name and attaches to the upper portion of the ramus of the jaw. So it has a big sway on tightness in the temporal mandibular joint. So just a little easy compression. On bigger people, I use forearm. Actually, Rose now actually I use forearm too. Pressure's okay?
Mm-hmm.
Easy. And then you could easily, in this position, lean in, do a little movement into the shoulder, okay? You can make compression and refine it a little bit. You can just lift up a little, pressure a little bit more. So, when people are doing compression, it's one thing, you have contact and you're leaning in. And then a lot of times if you're trying to increase the pressure for whatever reason, you can try to lean in more, or else you can refine the contact. So I'm narrowing the contact so it's a little bit more specific, and you just have to bend the arm to get more pressure. So that's how it works, right? And because after general compression of the top of the shoulder, which is lovely, you can stabilize the head and lean in. And then I would just do a little bit more, so from general to specific, basically. And then I can use here, and rather than poke with my elbow, I'm just using my arm to apply pressure. Right, I'm just bending here. Feel that pressure?
Mm-hmm.
So easy, and it's very specific. Right? And if you're working on the neck, and if you're familiar with the SCM muscle here, you want to work behind the SCM muscle, not in front, because you'll elicit gag response and carotid artery and all sorts of things that you don't want to be pressing on directly. So you want to look at location of the SCM, and if you know the general location, you could use the ear as a guide on the angle. So everything behind there is nice to add compression to, because it's right by the transverse process of the spinal cervical vertebra, and it has attachments of rotator and splenius and all the things that can compress the neck. So you can do fingertip compression, or else if you feel, and there's enough space, you can just use the back portion of your forearm to compress easy. Right. Also, a good spot in working the head and neck is up underneath the occipital ridge, you know, the base of your skull. And there's lovely acupressure points under here, but also this group of muscles called the suboccipital muscles. And they're responsible for stabilizing your head and the rocking and tilting of your head that's going on constantly when you're trying to navigate. Like every time we move or we look where we're going, those muscles are operating to try to keep the head so your eyes basically are aligned with the horizon. That's the process of it. So it's nice to apply some pressure under here, some general loosening. Now you could use your thumbs like this, easy. Or a singular thumb. But I'm using the head to open up and just lean in with my body weight. Pressure's okay? Mm-hmm. It's very nice and specific underneath there. And here I would use more of the pad a little bit because you want a nice broad area, because those muscles are small and usually a little angry because they're trying to stabilize your big old head on the cervical spine. It's sort of a weird dance, actually, when you think about it. Like a big bowling ball, like on a stack of dimes or something. It's really precarious. So they're doing a lot of work. So you can use your thumb. A lot of times I'm pretty easy using my elbow. I turn my elbow into it. Okay, Rose? But whatever's comfortable. So here, so this is nice. There's a lot of positioning you could do here, but just opening up the shoulder joints a little bit. I hesitated because I didn't know where her arm was moving comfortably. So I was going to try a few different things, but then I saw that I could come in like this easy. So I'm hooking right on the inside of the humerus. Easy. Okay. And just a few other things. So lift your head now, please. Okay. So let's see what to do now. So here. Open. So my leg is bracing the back, and I have here so I can use two hands. So I'm up on one knee and one foot, just opening up here. Because again, one of the things that compromises the shoulder girdle, along with the sits muscles, that are the rotator cuff muscles, is the pec major and minor. So the pec major comes and attaches here, but it also has strong attachment on the lateral side of the sternum. So there's that attachment, and this actually gets at that attachment a little bit. So you can just lean back with your body weight. So this they used to call collapse position. So you let your weight collapse on it to stabilize and just lean back. You can also keep in the same position and roll the pec out. So my thumbs are going underneath the muscle. So I'm doing pincer grip. But look, you see, right in front of me, and I'm just pincing and then getting all the motion by just simply leaning back. So this is more pec major. And then you can take your fingertips and come under pec major and feel for the rib. And then just slide until you bump into something, and that something is pec minor. And the pec minor is the muscle of those two that brings the shoulder forward more because of its attachment on it's called the coracoid process. So I'm coming right into the side of the pec minor muscle. So I'm going to pin and then stretch. Feel those? Mm-hmm. So it can be pretty strong. So to find, rather than poking around, pads your fingers, feel for the ribs, and you're underneath the pec major. And then you just slide on those ribs medially and you'll bump into the lateral border of the muscle. And you can just hold it there. Do a nice pin and stretch. It really helps open the shoulder. Right? Other thing, working right into the armpit here. You're at the back a little bit.
You're in the teres?
Exactly, teres. So teres is one of the rotator cuff muscles. And this is where the anatomy suits me, right? Because I can look at that. If they're coming with some shoulder range of motion problem or something, I allow that anatomy then to come up to the surface. And then I flip that lens, like at the optometrist. Is this better? Or is that better? You know? Because I don't know. So just to be able to have that base anatomy to inform your work. Cool. So collapsed position, you get a bigger stretch. You can move back and just use the arm. So you get, it goes into the hip a little bit more. Cool. If you do, come over here, y'all, for a second. Now, you know, I was trying to get to back here the teres. Also, too, in shiatsu, there's some really classical acupressure points right in here. Spleen, small intestine 9 and 10. They're right in the belly of teres. So this is why we go for teres. But an easy way of doing teres is working this way, because they're right here. And so you can come up to the axillary crease, the top, and you can support here and just lean in. You feel those?
Yeah.
It's easy, and it's more sustainable. So you can stabilize and just lean in a little bit, and you're right in the belly of the muscle. That'll help release it, and it gives it a little bit more of a chance for the range of motion to increase. One other thing I want you to try in Sideline is, first of all, this stretch. After we work there, we want to stretch it out a little bit. So that's an easy way to stretch this area really nicely because of the angle. It makes a difference when you're approaching on a muscular level, knowing the basic location of the muscle, so you can apply a stretch as directly pulling it or stretching it. So this is really nice for this area, and then up slightly for teres. So easy. Thank you. So this way now too. Now we'll save that for another time. Let's just do that little bit.